So a very good morning to all of you. It's my pleasure and honor to welcome you all to the International Consultation on Cigarette Filters, implications for health effects and environment. We have a keynote speaker and our chief guest with us today. Welcome, sir. I will. It's again an honor to have Dr. Prakash Gupta and Dr. Thomas here. They are experts in this field, and it's a very warm welcome from our side, sir, to this international consultation. I'll just go through the agenda before we start with the presentations. We will have Dr. Rakesh Gupta, who's the chair of the tobacco control section in the union. He'll be giving an overview, followed by Professor Sonu Goel, who will be talking about cigarette filters and public health impact and Indian perspective. Then we have a keynote speaker, Dr. Thomas, who will be sharing his thoughts. Followed by Dr. PC Gupta, who's the director from HEALIS, who will be giving the special remarks as the chief guest, followed by a Q&A session, which will be moderated by Ms. Upinder, who's from the tobacco control section in the union, followed by a vote of thanks. I would request everyone to please keep yourself muted. If you have any questions, you can write it in the chat box and we can take it at the end, or you can unmute yourself during the Q&A section. With this, I would like to welcome uh, Dr. Rakesh. Sir, if you can please give your address.
Yeah, sure.
So,
Yeah, you can skip this. Yeah, you can
yeah,
skip this.
okay. So will you be sharing from your end?
No, you can share.
Oh, it's, sorry. Just give me a second. Yeah.
Yeah. So good morning, all, and good night for actually Dr. Tom. So the cigarette filters have been used as a marketing tool since more than 7 decades, and they make cigarette smoking more palatable and also mislead consumers into thinking that their health risks are substantially reduced. Although machine smoking measures of tar, nicotine, and carbon monoxide, they are lower in filtered than in unfiltered cigarettes. The difference may not reflect the true exposure of people who smoke toxicants. The filtered cigarettes, they have not prevented the continued epidemic of smoking-related diseases. In addition, the predominant cell type of lung cancer caused by smoking has changed from the small cell and the squamous cell to the adenocarcinoma. The addition of filter ventilation, the manipulation of nicotine and other chemical content in tobacco and other changes in commercial cigarette design. Next, please. So moreover, people who smoke discard trillions of poorly degradable cellulose acetate filters globally each year, which are a source of microplastics and chemical hazards. Discarded filters retain some of the nicotine, metals, other toxicants from smoke filtered cigarettes that contaminate the environment into which they are discarded. And Dr. Tom, our keynote speaker, will tell you in detail about this. Despite the lack of evidence that filters substantially reduce health risks and there's lack of evidence actually. The evidence that filters contaminate the environment, misconceptions about filters' function and composition, they persist. Next, please. So, as per the NGT order, that was in 2022, the way forward is following options may be explored for effective management of cigarette butts to assess if single-use cigarette filters can be included in the list of banned single-use plastic items covered under the extended producer responsibility under the plastic waste management rules, to explore alternatives for the elimination of single-use filters to reduce post-consumption waste, to consider levying litter fee on the cigarette manufacturers to pay for cleanup and anti-tobacco product waste education and advocacy programs. So thanks a lot, and over to Dr. Preeti.
Thank you, sir, for your remarks. It is my pleasure to invite Dr. Sonu Goel, who is a professor at the community and professor of community medicine at the School of Public Health in uh, PGIMER. He will be giving his talk on cigarette filters and public health impact in Indian perspective. Dr. Sonu,
Yeah,
sir, over to you.
yeah. Thank you, Paridhi. Thank you very much for your generous introduction, and I'm really glad to see here Dr. Prakash Gupta sir and Miragi madam after a long time. Uh, Thank you for being with us. I think you have been our torch bearers in our country for tobacco control, and uh, and I think I want to thank again Professor Thomas for being here. I think I was just reading the article when Dr. Gupta shared one of the NGT order. I was reading your articles, and I think it was an eye opener. Actually, I was having a little idea about how cigarette filters actually are harmful, but I think the quantification which you have given. So some of the contents of this presentation which I am giving, although I have not made it, but I'll be speaking on it, so will be taken from your articles. So it's acknowledgement for that sense, and and Dr. Rakesh Gupta from Jaipur and Dr. Rakesh Gupta of Sipher. I think thank you for being with us in this series of webinars on tobacco control, which we have been doing along with Sipher. So I think. First of all, the audience, this should be a relatively newer topic for audience, although it's not that new because cigarette filters. So when it was introduced, actually, if we go with the slight history of it, so I was just reading that it was introduced immediately after um, uh, that it was declared that smoking causes lung cancer. Actually, it was in 1950s when there was a relationship which was found by Don and Hill that there was a direct causation of smoking with lung cancer. And now you must be wondering that why cigarette filters then? So it was actually a deceptive strategy of tobacco industry that if you just have this filter with the cigarette, you will not cause this lung cancer. So you will not cause the lung diseases. So it was a very deceptive strategy which was made by tobacco industry, and it says that it has a lot of filters, it has a lot of ventilatory holes. We call it filter ventilation, right? So it is not, it will reduce your risk. And definitely when people started taking that cigarettes, they feel that it is smoother and they tend to inhale more deeper because it is more smoother as compared to the previously unfiltered cigarette, and it has a reassurance which was marketed across that it is safer, right? So that actually was even harmful when when there was the association between lung cancer and cigarettes. So it actually proved to be harmful, and tobacco industry could take advantage of that fact. In fact, so that was just an history. But I think we had this cigarette filters again came into market because of three major failures. Number one is it is a misleading public health messaging, because if you have a public health messaging which is misleading, I think you can have a suit on that. So this is one thing which is there. The second is there is a escalating public and this plastic and chemical pollutions because of it. We will be talking in detail, I think, later. So that is one thing. And the polluter principle, I think those people who are polluting, the extended polluter principle does hold true in this. So that is one thing which we are not doing very much. So that is second thing. And the third thing is the weaker accountability of tobacco industry. We are not making them accountable. So these are the three policy failures because of which this type of filters, they are being invented newer and newer. And now we can see that even that filters are also invented a lot. Now we can have capsule within the filters where you can just press that capsule when you are taking the cigarette, and it contains menthol and it gives you a better flavor. within that. So I think there are a lot of inventions which has been made by tobacco industry, not because that they want to save us from these dreaded diseases, but they want us to consume more. So that is one thing. I think related to health and environmental impact. So there are a lot of studies. I was going to literature. Then there was in Journal of Tobacco Control in 2021. They have categorically told by League et al. That cigarette filter provide no measurable benefit at all, and it was never designed as a public health intervention. So I think it was the punchline there. And we can see that a Journal of National Cancer Institute, which reviewed the population level cancer trends, and it is seen that since the filtered cigarette arrived, there was a shift of lung cancer type. Now, since 1950, when the cigarette filters arrived, so the squamous cell carcinoma, which is a relatively milder form of cancer of lung, shifted to adenocarcinoma. Why? Because people tend to inhale deeper, and when they reach the deeper part of the lung, then it causes adenocarcinoma. So that is another thing which was documented in the studies. And there are multiple other studies which shows that filtered cigarette does not reduce lung cancer risk, heart diseases, COPD. I'll not go into each and every studies for it, but they have shown that in fact they have actually there has been increased risk with these diseases. Now, what is the WHO position? WHO says categorically that it is a marketing tool, not a public health intervention. So categorically, I think WHO has said that, and various public health institutes, associations are aligned with the position of WHO, and they say that filters undermine cessation, they create a false sense of safety, and they mislead youth and new smokers to smoke even more. So I think this has been very categorically said. So, and a key fact which has been quoted in one of the papers is that 70 years of filters. Now we are almost on the, I don't know what we say after 75 years, they might be celebrating it, but 75 years of filters and 0 years of proven benefit. So there is no benefit at all. Now about environmental impact, I think briefly, if you say 170,000 tons of tobacco waste annually, I was just trying to see what that 170,000 tons means. So there is a corollary that 13 large aircraft carriers or 2,000 plus filled swimming pools. So if you larger swimming pools, if you fill that cigarette litter with those swimming pools, you can fill almost 2,000 large swimming pools with that cigarette litter. Right? So that is one corollary which I could find from the literature. And just one cigarette filter, again, just one cigarette filter can contaminate 1,000 liters of water. And now you can imagine that if we have the 2,000 swimming pool filled with cigarette filter, how much water contamination it can cause. Right? So that is another thing which was there. Now, India specific things, basically, that India, there is a lot of other problems with our country, that there is a blockage of drains because we have a drainage system. So it causes blockage of drain, and there is urban flooding. And we have seen in Mumbai, I think specifically, but it might not be caused in Mumbai exclusively, but we can see that during the rainy season, many of our areas got flooded. So one of the reasons why it is there is because of this cigarette butts. Now about the law. So our law, COTPA, Cigarette and Other Tobacco Product Act, doesn't categorically say about that it is a cigarette filter should not be there. Neither say tobacco product rule, neither categorically by plastic waste management rules. But what is there in plastic waste management rules is that we can ban single-use plastics. Now, single-use plastic is a very good strategy. We may not have a definite rule for it, but even that rule is sufficient enough to ban the cigarette filters. So because the cigarette filter contains the cellulose acetate, I think that is a type of plastic material which is there, and we'll be talking more about it. So I think that is one thing which we can always uh, vouch for. The second thing is I talked to you about extended producer responsibility, that is EPR. That is those who are creating the pollution should pay for the pollution, right? So many cigarette butts are being there. I have told you about that, but the cleanup cost falls on the municipalities, falls on the government. So they are creating pollution, and we are paying for that. I think that is another. It is time that our civil societies and other people should vouch for that extended producer responsibilities, and especially about the advertisement, that misleading claims about filter design, ventilation, capsules, slim filters, all those things should not be there as per our advertisement rules. So advertisement rules clearly says that we can't have deceptive message which can harm public. So I think these are the things which are there. So cigarette filters fall between, it's not extendedly by the health department, it falls in Ministry of Health, Ministry of Environment, Urban Affairs, and many other ministries. So I think they need to work together. If we want to really ban, no single ministry really owns it, so we need to ban this. And there has been few innovations which has been there in our country as well, like about nanofiber filters or graphite based filters, which actually absorb which they say is that they absorb the nicotine and all those things, and there are some cigarette butt recycling, but they have no proven benefit. So I just end here by saying that the filter is actually for sustaining consumption of cigarettes, not for reducing public health harm. So they persist in India because they work. They work for tobacco industry, but not because that health, environment, or anything which they are benefiting. Right. So that is one thing which I wanted to say. So thank you. I think I look forward to a very nice discussion which will happen in this webinar. So thank you, Dr. Rakesh.
Thank you, sir, for your talk. I'll just share my screen again. I will now welcome Dr. Thomas uh, Novotny. He's the Professor Emeritus of Epidemiology and Biostatistics at the San Diego State University in the School of Public Health, and he will be talking about the cigarette filters and its implications for health and the health and the environment. So over to you.
Thank you very much. I'm going to go ahead and share my screen. And I want, if I can find the right one here. Let's see. There we go. And on we go. Okay.
Yeah, sorry, sir. Uh, Before we start with the presentation, I just have a small request. If we can just take a quick picture group photograph with all of us, if that's okay.
Let me just do that then. All
Yeah.
right.
All right. So if I would request everyone to please switch on your cameras and please give a big smile so we can take a good photograph. So on the count of three. 1, 2, 3, smile. Great. I've taken, and I'll just take one more. So again, on the count of three. 1, 2, 3. Yep. Thank you. I'm so sorry to disturb. Sorry, sir, but I just kind of remembered that we did not take a photograph. So over to you, sir.
Got it. Thank you very much. And I just want to say thanks to the previous speakers for really outlining some of the major points that are need to be made about the issue of the filter and its potential implications for both health, human health, and also the environment. I think it really is something that is starting to rise in attention to a lot of agencies, including, of course, the WHO, as was mentioned, but also state and local health departments who are at the tail end of the receiving of this toxic hazardous waste. And now with the Conference of the Parties last a couple of weeks ago, that is to the Framework Convention on Tobacco Control, the WHO's International Treaty on Tobacco Control, it has risen to an international focus as well, and is getting some attention finally as something that can add to the fight against tobacco use by virtue of its environmental consequences. Environmentalists are pretty effective advocates. I think they're in many ways more effective than many of us public health people. And they've had some success in dealing with this issue. I'll mention that a little bit later. But I've been working on this for probably 30 years as an issue that, it's been hard to focus attention on it. We all know about the hazards of smoking, I think. People are very well versed on the risks in terms of cancer, pulmonary disease, cardiovascular disease, but not so much on the environmental potential implications. Let me see if I can get going here. So what I'll do is some of the history of cigarette filters has been discussed. I'll just fill in a couple of things. We'll talk a little bit about the anatomy of the filter and some of the chemistry and ecotoxicity issues. I do want to focus on biodegradable filters. This is oftentimes brought up as an option for the cellulose acetate or plastic filter, which is found on almost all cigarettes. And I want to say up front that this is not a good idea, and I'll tell you why a little bit later. We have been able to assess a lot of knowledge of the public about attitudes and beliefs about filters because there are extensive misunderstanding about both what the filter is made of and also what it does, as has been described already. Also, I want to address some of the issues that the tobacco industry has been bringing forward. They love to get involved in this as a corporate social responsibility activity in protecting the environment. So they've got all sorts of great ideas about protecting the environment against the tobacco product waste, which usually involves recruiting volunteers to pick up the waste for them, or finding ways of manipulating public policy so that they don't really take responsibility, even though they may put some money into the cleanup activities. I want to talk also about what is happening going forward. The filter ban is something that the ban on the sale of filtered cigarettes is something that I really am trying to focus on. There are ways of getting at this, either through regulatory policy, but also litigation. And we've got one lawsuit now that is being perpetrated in Baltimore. I'll tell you about that and what the premises are on that, because I think that has a lot of potential going forward. We've had lawsuits to recover the costs of healthcare costs due to cigarette smoking illnesses, which have been very useful in terms of both recovering funds for jurisdictions, but also for opening up the background papers, the lies, the science that really needed to be done to show how the tobacco industry has deceived and perpetrated a fraud relative to just the hazards of smoking, but also because of some of their response, which has been described well with the relation to the filter. And I do want to review a little bit about what's happened with the Framework Convention on Tobacco Control. I was able to go to the COP meeting, the Conference of the Parties meeting in Geneva a few weeks ago, where I think there were 160 countries represented, who many of whom had already moved forward with some of this information about the plastic piece, because at the same time, the tobacco treaty has been in place now for, since I think 2004, but there is a treaty now being negotiated on plastics internationally. I don't think it's going anywhere, but at least the issue of plastic filters was brought into that discussion as one product that could be eliminated because it has no functional reason to be there, that is the plastic filter, and that could be eliminated without having too much consideration for a treaty agreement, actually. At any rate, that's not going anywhere, I'm sorry to say. The history goes actually even farther back than the 1950s. 1860s is when filters were first described as something to keep bits of tobacco out of the smoker's mouth. There were lots of kinds of filters that were tried out: paper, wool, cotton, and there was even a filter made out of asbestos. I think it was Kent filters that actually had the asbestos filter, which, as you know, is a carcinogenic material as well. But when you're smoking cigarettes, the industry can get away with whatever they want to say about the filter, and asbestos was probably thought to be something very protective. But the first health scares were in the 40s and 50s, and there was then a lot of research that was implemented, not just on filters, but on the design of the cigarette in general, the kind of tobacco, to see if they can't reduce that risk, because they could, the tobacco industry could see the future, that when people realize that the cigarettes are harmful to you, despite the fact that they're addictive, it would definitely affect their bottom line. Well, the micronite filter, I did have that listed here. That was one of their answers. So, in the 1950s, again, we were down like 1% of cigarettes filtered. But the major impetus then for filters, as well as other kinds of design research, came out of the Royal College of Physicians, a report in 1962, and the first U.S. Surgeon General's report on smoking and health in 1965, where these cancers, other diseases were clearly identified as causally related. And that's really an important word to be used, because there were criteria that were developed to say how you can tell something was causally related. It wasn't just associated, it wasn't just suspected, but it was causally associated. And that was a really critically important conceptual process at the time. And since then, there's been other reports that, of course, have done this. And I like to show this graph. This is the United States, and I'm sorry I don't have one that would be global, but I think what it demonstrates is the change in the market over the time period between 1925 and 1995, where from hardly any filters being, or any cigarettes being filtered, to almost all. In the United States, it's 99.8% of cigarettes sold. I mean, it's hard to find unfiltered cigarettes, but they still sell them. And they're sold elsewhere in the world, of course, too. And what we can estimate globally is it's over 90% of cigarettes sold globally, commercial cigarettes that are sold globally, are filtered. That, of course, does not include BDs. BDs may have a filter. I'm not really too familiar with all those products. Maybe somebody can enlighten me on that a little bit later on. But it does mean all commercial cigarettes. Robert Proctor is a historian at Stanford University, and he wrote a book called The Golden Holocaust. And in a chapter in that is called The Filter Flim Flam. And he does a great job of going through the history and, again, emphasizing this marketing tool that was there, but it had a couple of purposes besides just marketing the cigarettes. It actually lowers the cost of manufacturing. Believe it or not, the filter is cheaper than the tobacco. And one of the things that's, I think, important to know is to recognize is that the unfiltered cigarettes back then had more tobacco in them than a filtered cigarette, just by virtue of the length of the rod, which has implications in terms of the previous studies, older studies that said that filtered cigarettes were safer than unfiltered cigarettes. Part of the reason for that was there's more tobacco in an unfiltered cigarette, and therefore more opportunity for the smoke and the inhalation of those chemicals to cause disease. So that there may have been that differential back then, that some studies showed that there was reduced risk for lung cancers and other diseases as a result of filters. Not because of the filter, but because there was more tobacco in the cigarettes. So that's one thing. And then again, is to keep the tobacco bits out of the mouth. And this is probably the principal reason people use cigarette holders in the past, those long kinds of things. And something that will affect any kind of filter ban. Cigarette smokers don't want to be having bits of tobacco in their mouth. So there'll undoubtedly be some sort of response to that technologically, or add-ons or whatever. But makes it easier to smoke is what really the issue is. And it convinces people into thinking that filtered brands are somehow safer than unfiltered brands. So those are, I think, the big principles in terms of the history of filters. So the cellulose acetate is the most common type of filter, and this is manufactured not by tobacco companies, but by chemical companies like Dow and let's see, Eastman, and there's several others. I think there's about 6 major international companies that manufacture filtered cigarettes, which has some implications in and of itself, in terms of the plastics treaty, for instance. It's a partner to the tobacco industry. So big chemical companies are partners to the tobacco industry when it comes to their product, the filter being eliminated. They're going to act out against this. It's not going to be just the tobacco companies. So, but this plastic is a plant-based plastic. It's not petroleum-based. So it's not the petroleum companies. In the plastics treaty, it's the petroleum-producing countries that were really the resistance to any sort of agreements in the plastics treaty that I mentioned earlier. So there are strands that form what's called a tow, which is this sort of rod of filter material. And each filter has about 12 to 15,000 strands, and is combined with some plasticizers and other chemicals, which we can detect in leachates or filters that expose to the liquid environment. They're not very degradable. They can be degraded with optimum conditions of light and temperature and moisture in the environment. But there's been several different studies, laboratory-based studies primarily, and it's difficult to find filters in the environment and know how long they've been there. But what we do know from laboratory studies that alter the environment, they can last up to 10 years in an intact filter. But that doesn't mean that they haven't just fallen apart or degraded into microfibers, microplastics. The filter itself would be considered a macroplastic because it's greater than 5 millimeters in length. But then the microfilters, or rather the micro particles, are varying sizes in the micrometer range, and these can persist in terms of both the chemicals that are attached to them and the plastics that they become. And as I think, are all learning, microplastics are all over the environment, in our bodies, in our food, everywhere. And some of those are from cigarettes. We know that the cigarette filter is actually the single most picked up item of trash in the world. That is based on beach cleanups that go yearly throughout the globe, but also just about any urban cleanup that reports the number of pieces of trash that are picked up, any beach cleanup, it's cigarette butts. And the story there is that even if you pick them all up, and we've done studies here in San Diego where we've basically sterilized 60 census blocks, and then gone back 3 months later, and it's the same amount of cigarette butts there. It's the continuous supply. So cleanups don't work, period, because we have a continuous supply of this pollutant that just continues to be deposited in the environment. So that's why recycling, even if we picked up all of these things, or we never would, is not a good alternative. There's been all sorts of opportunities, such as construction materials and pallets that used for moving stuff around and outdoor furniture. And so these, recycling would depend on picking up cigarette butts. But what we know is that, the picking them up represents only a minuscule amount of the total count that's out there. So recycling is never going to be a really very effective way of reducing that burden. And a little bit more about that later as well. There are some other problems. It was found on the lung tissue of smokers who died that there are plastic particles in them. In other words, there's filter fallout, which means, that, this filter that's supposed to filter out chemicals is actually breaking up into pieces and getting into the lungs of smokers. The industry has known about this in the past, and cadaverous research has shown that this to be the case, that it does happen as a result of the microplastics that are deposited from the filter itself. Ventilation was mentioned. Ventilation makes it easier to smoke. It dilutes the smoke that comes in. It actually is the kind of the main way that cigarettes have been called light and low tar in the past, because you can dilute the smoke that is measured in a machine and say, oh, well, there's less chemicals in it as a result of this dilution. But the fact is that machines don't smoke like people. When someone is not getting their nicotine dose, they're going to inhale more deeply, more aggressively, more rapidly, more frequently. And it's something that doesn't really mean anything when it's measured by a machine. So, but the filter ventilation is there. It makes it easier to smoke, and it reduces the measured tar and nicotine levels in machines. Here in the United States, legislation now is, in several other countries too, that you cannot use the words light and low tar because they're deceptive advertising. And in fact, the industry was forced to put some apologies in the newspapers and media here in the United States as a result of a court ruling that said they had to use corrective statements to say, look, they've been lying about this light and low tar business. It doesn't make any difference if a cigarette's light and low tar, they still kill you. So all of that's now banned. And the issue of lung adenocarcinoma was mentioned earlier too. And I just want to show you these two graphs. And the reason I do is that it shows the adenocarcinoma incidence rate on the top for men and women. That cell type of lung cancer over time since 1970 in these cases. And this is based on nationally representative cancer registry data. And the other lung cancer cell types are actually going down in incidence. So that's good. And, the actual number, at least in, those places where we can measure it, cases of lung cancer are going down, not because of the filter, but because people have quit smoking. And that's important. The adenocarcinoma in the past was oftentimes presenting rather late in the course of illness, making it a much more aggressive, difficult to treat. It's going to be stage 4. Now, at least in the United States and many other places, screening is recommended for people who are heavy smokers and likely to develop lung cancer, so that they can actually catch this before it gets to a higher stage, and perhaps has actually improved the prognosis of adenocarcinoma. But nevertheless, adenocarcinoma is worse, in terms of outcomes than the other cell types. So that's another problem. So getting on a little bit more on the environmental side, it's difficult. We don't know how many butts are tossed into the environment. There's no surveillance system. What we do have are self-reported kind of behaviors by people. We can have some observational studies. There are some people that go around watching people smoke and see where they toss their butts. There's a lot of, very environmentally advocate type of folks involved in this now. But based on these, there's a range, I think, of cigarette butt deposition, and that's from about 33 to 75% of filtered cigarette smokes may be discarded into the environment. That's a big, wide range, but that's a range that's calculated against about 5 trillion cigarettes sold each year, commercial cigarettes, legally. There's another probably, 700 million or so that are illegal sales. So, it gets up to 5 to 6 trillion cigarettes a year. And of those, a third or two-thirds perhaps, are dumped into the environment. Almost all of those, more than 90% at least, are cellulose acetate. So we can calculate out how much butt waste there is and how many are dumped into the environment. It's somewhere between 2 or 3.5 trillion. And the burden of microplastics becomes something around 143,000 to 323,000 metric tons each year, plastics due to cigarette butts. Filter weighs about 0.14 grams. So that's not nothing. It's quite a lot. And is it getting into our bodies? I don't know. We can actually identify it in the environment. We can, on the second column here, I made a comment about the San Francisco Estuary Institute did a study. And I think this is an important one because what they did is they measured output of plastics coming from the runoff from the streets into the sewers, into the storm drains, and measuring what's in that. And they found that there was cellulose acetate in those in that runoff. In other words, it's there in the environment. We know it's happening. Now, what else could that be from besides cigarette butts? Well, not too much else. Cellulose acetate is rayon, so it's in clothing. Nobody's going to be throwing their clothing into the storm drains. It's in eyeglasses, and it's in a photographic film. Those things don't get into the storm drains very often. So if it's cellulose acetate washing off into the storm drains, it's probably from cigarette butts. They found it. We don't know how much it is, and it's hard to differentiate it from other kind of cellulosic plastics, but it's more than likely that it's going to be cigarette butts. And so each filter can release about 100 plastic microfibers a day. What we found in laboratory studies, and I participated in one, oh geez, it's been 15 years ago now, where we followed an EPA standard process to determine whether or not a waste product was hazardous. And this is used to actually, for companies to determine whether or not their waste products from a manufacturing process are toxic to the environment. So it's a standardized procedure where we expose both fresh and saltwater fish to leachates, that is the kind of soup that is produced by soaking cigarette butts in water for 90 to 96 hours. And what we found is that 1 cigarette butt in a liter of water kills half the fish. That's the lethal dose 50. So that classifies it as hazardous waste in my mind and many others. There have been many other studies that have done using other kinds of organisms, fleas, frogs, worms, mollusks, fish of other kinds, plants even have been shown to have an adverse effect. And even people who have accidentally, that is kids, or animals like pets who have accidentally consumed cigarette butts have had toxicity issues related to that exposure. It changes the diversity of microbial communities, meaning if there's a lot of cigarette butts in a microbial environment, it makes it harder for that to decompose, in other words. So we also have done some laboratory work to show that the chemicals, and these include nicotine as well as many of the other 7,000 chemicals in cigarette butts, and 50 of them are carcinogenic, can bioaccumulate in organisms such as filter feeding mollusks, shellfish, or trout, other kind of fish that might be in the food chain. So is it possible that they get these chemicals into the food chain? Yes, it's possible. Do we have evidence of that happening? No. There's a lot of evidence from the lab, but we don't have the evidence that shows exactly if there's that kind of environmental pollution entering into the human body. That's somewhat of a challenge, but at the same time, we have a principle called the precautionary principle in environmental contamination, environmental studies. And that means that you don't have to show that these things are hazardous, are actually causing adverse health effects in human beings in order to regulate them so that human beings are protected from those health effects happening. If we'd known that cigarettes were so damaging to the human body back in 1950, perhaps we would have regulated them out back then. What we have now is this evidence that shows laboratory-wise that there's this toxicity as a result of tobacco product waste. Do we want to wait until it affects us? Do we want to wait until we see that the microplastics cigarette butts are causing neurological damage, for instance? I don't think so. Again, I mentioned that cigarette butts are the single most picked up item of trash in the world. And this is a chart just showing that the number of debris items that are collected in beach cleanups. And this happens every year in September. It's called the International, anyway, it's a regularly scheduled thing. It's sponsored by the Ocean Conservancy. And so cigarette filters are really the most common item. It's about a third. And this is the case in urban cleanups too, somewhere between 20 and 40% by count of trash that's picked up in urban environments are cigarette butts. So it's there, and people go out and collect them. You know, get volunteers. We've done a lot of collection to be able to identify not just how many butts are out there, but when they reaccumulate, but also what variety of tobacco product waste there is, whether it's vapes or you know, packaging or whatever. So you know, all of that is part of this tobacco product waste cleanup activity. And again, what I'd like to just re-emphasize that cleanups are the natural response that we have to picking up things out of the environment. Environmental groups have been doing this for a long time. But when you start talking to the environmental groups and say, look, you know, it's possible that we could prevent this from happening, wouldn't that be a better public health approach to cigarette butt waste instead of just picking it up and cleaning it up and then trying to find a place to dump it as well? I've done butt cleanups on my campus, and then I sit there with this big pile of smelly cigarette butts outside my office wondering what I'm going to do with them, and basically we put them in the trash. What does that mean? Well, they go into landfills, and landfills ooze out all sorts of chemicals and things too. And yes, they are detectable in the chemicals outside of landfills as well. So what I'd like to emphasize, though, again, as I mentioned at the beginning, there's a concept of a cigarette that is made up of tobacco and a filter that means it's a cigarette. It's defined, it's normative to have this filter as part of the cigarette product, and we can't do without it because it's there not just for, you know, keeping the particles out of your mouth, but it's, you know, filter. The word filter says that it's doing something. Well, it's a misnomer. We've analyzed, you know, self-reported responses on lots of different surveys. National panel survey, just using internet access. You know, smokers and non-smokers believe filters reduce the harmful effects of smoking to a large extent. Adolescents thought the filters actually harm the environment. Only about half of them knew they were plastic. Philip Morris has surveyed smokers, and they actually get worse results than we have done, where they thought their smokers thought that filters were plastic only 13% of the time, and they thought 25% of the time that tossing butts was the correct way to dispose of their filters. There's no instructions on a package of cigarettes to say what the correct way of disposing of your filter is. The ITC smoker survey in 4 countries showed about half of people these are smokers, believe that removing filters will make it much more harmful. Well, we'll see about that. I think we've got some opportunities to understand what happens after removal of filter. We did a clinical trial of actual smokers. This unfortunately happened during COVID years, so we lost a lot of people in follow-up during that time. But we did basically a proof of principle study that showed a group of committed smokers who weren't planning to quit, where we you had half of them smoke, and we only had 42 people in this study. I have to tell you, it's very small. But what we were able to do is show that it's possible to do such a study. And half of them were on filtered cigarettes, and then half of them were on unfiltered of the same brand. And then they smoked these for a couple of weeks, had a washout period, and then crossed over so that they were their own controls. And we found that there was no difference in the chemicals produced, NNAL and nicotine, in their urine. We found that they smoked fewer cigarettes if they were unfiltered, and they found that there was less pleasure in smoking if they were unfiltered. All of which we think leads to us, what the assumption is that if we have unfiltered cigarettes only and not filtered cigarettes, people will smoke less. Hopefully they will not take them up as much as youth, and that there will be perhaps fewer cigarettes smoked per day, all of which will have positive health effects. So it's not that easy to do that kind of study. I think there's brewing another study that's going to be larger, longer in term that might help with this. And as I wind up here, I just want to mention the industry again. You can, I think this website is no longer up front, but Philip Morris launched Our World Is Not an Ashtray. And their initiative was to try to reduce plastic litter from filters and cigarette butts by 2025. Well, they didn't do too well with that. What they did do was try to recruit volunteers to go out and pick up their trash. And that's basically their response. It's greenwashing. It's a corporate social responsibility that doesn't work. And as I mentioned, anything that relies on picking up to the cigarette butts is not going to reduce the quantity, because for instance, the International Coastal Cleanup picks up about 1 million each year of cigarette butts. And again, what we have is almost 5 trillion. So 1 million out of 5 trillion butts picked up on the coastal cleanup, and no matter how many cleanups there are around the world, is not going to touch that burden. So they they get some good press from this, and they get all sorts of self-reported good feelings. But this is a downstream approach, and as public health people, I think, appreciate much more of an upstream approach, which means, to me, product regulation. Recycling, as I mentioned, requires an extensive infrastructure, technical transport, handling, hazard materials. The products, I don't think, are going to be economically viable. Nobody is going to want to be sitting on chairs that are made out of cigarette butts. This stuff stinks. And this is not something that then could succeed as a circular economy, not for tobacco products. Biodegradable filters, the industry has studied this. They gave up on it back in the 2000s. There are some cigarettes now that are called natural, and natural. Everybody likes to call things natural and organic. And there's a techie group called Green Butts that is trying to develop a filter that dissipates rather quickly after being disposed in the environment. But what this would do is, again, give the industry more cover. It's greenwashing. It would make it easier for people to discard their cigarettes as a result of this and have less guilt. But if you think about this as a regulatory issue, in the US, at least under the FDA, they would have to show that the cigarettes are less harmful with this filter, and they're not going to be able to do that. So biodegradable filters are not an answer. Recycling is not an answer. Cleanups are not an answer. Banning the sale of filtered cigarettes is the answer. Now, the study group on tobacco product regulation, I contributed a chapter on this. It's available, and there's a link down at the bottom here. And the recommendations of the WHO Tobacco Products Regulatory Group was to implement a ban on filters, to phase them out, and make sure that the industry doesn't get into the policy actions on this, and to ensure that there's dissemination of information on the misconception about it that persists to this day. And even among the scientific group that I mentioned meeting this morning, that I was part of, there are still some skeptics and wondering about what are the unintended consequences of a filter ban. The Framework Convention on Tobacco Control, COP 11 meeting had a report by the Convention Secretariat. Again, there was 5 of us who produced a 100-page report and reviewed all of the literature, all of the scientific studies, all of the, information that we could to support the countries in consideration of a filter ban, especially, but also other kinds of actions that might reduce the environmental consequences of smoking. And they've come up with the regulatory options. Banning single-use plastic containing tobacco products would be, this is in the report, that is, one of the main outcomes that we would hope to get. Now, at the meeting, this was debated, and there was a lot of discussion about it, a lot of still doubt and lack of information. And notably, at this meeting of tobacco control advocates, there were no environmental advocates there. And I think that limited what people could understand or take into account, in terms of this consideration of a filter ban, because the environmental pieces are not front of their minds. It's still filter. Maybe it helps a little bit with harm reduction, but none of that really is, based on science. So it's going to take another bit of time. So what they did do was they developed a decision on Article 18 to establish coordination between health and environment, as was mentioned earlier by one of the speakers, and possibly consider the classification of tobacco product waste as hazardous, actually, and being handled then under other kind of regulatory authority in terms of waste management. See, this gets into something that's not tobacco control, but environmental waste management control, to develop studies and estimates to look at the costs and associated environmental problems from these from cigarettes, as well as nicotine products otherwise, and to come up with comprehensive regulatory options. This is what would translate into, again, a filter ban. So they're going to consider it. Hasn't been done yet. The next COP is in 2 years, and hopefully by then they'll be more significant. However, I would like to say that some local areas, and the local governments that are responsible for waste management, they are taking this very seriously. In Santa Cruz County, which is on the coast here, where surfers abound and beaches get cleaned up every month, and they find cigarette butts every month, even in a state where the prevalence of smoking is less than 10%, passed a law that banned the sale of filtered cigarettes. Now, yes, of course, people can go outside the county and buy them. This is the start of what could be a more extensive, hopefully, locally based intervention. In the background here, you see surfboards. These are made out of cigarette butts that were collected from the beaches, manufactured into surfboards that they actually used, went around the country and went around the world with these surfboards trying to activate environmental advocacy against tobacco product waste on the beaches. Made a movie out of it. It's called The Cigarette Surfboard. If you can Google it, you'll see the trailer on that. It's really sort of interesting. I'm in it, and it's fun to watch. And finally, Baltimore City. I mentioned the lawsuit. They have filed a lawsuit 3 years ago and are moving it forward and have been fighting off all sorts of challenges from the tobacco industry, because the industry knows this is bad news for them. They've been able to estimate the costs of cleanup, cost of waste management of tobacco products, and they have data. And they have data because of Mr. Trash Wheel, which is this device, and there's 5 of them on the inner harbor of Baltimore that suck up the waste from the sewers, from the surface drainage of the city, and then they have volunteers who once a month count it up to see what's there. And guess what? Tobacco product waste is the #1 item collected in these Mr. Trash Wheels. So they have data. They have data on costs. They have data on the public nuisance. And what they're saying is that the cigarettes that with filters are a defective product. There's been no warning to the city that they contain plastics. There's no warning on the packages as to how they should be disposed of. There's there's an alternative to them that is unfiltered cigarettes, and they feel that they have a very strong case, and it's been defended against lots of challenges already, to bring a case against the tobacco industry and collect $150 million at least initially on the basis of a public nuisance. So we'll see how that goes. The main messages I want to make are that cellulose acetate filters are a non-essential source of widespread plastic toxic waste. Disposable vapes, ends, and waste, and waste and other kind of waste are considered hazardous. There's a huge knowledge gap that still is there about this fraudulent marketing tool, and that environmental advocacy joined up with tobacco control people can make a big difference in terms of local or perhaps even state or provincial actions against tobacco. We still need some research needs about the unintended consequences of a filter ban. We need research about the kind of messaging that can resolve this misinformation that we have. So I hope that we can move forward on this. I really appreciate the opportunity to talk to you, and I hope I haven't overstayed my time. I'll let you go on, and just these are the conclusions. I'll let you have these as my slides. You're very welcome to share them, and I look forward to the discussion as we move forward. Thank you very much.
Thank you, sir, for giving this very amazing talk. I would now invite Dr. Rakesh Gupta to introduce our chief guest. Sir, over to you.
And thank you, Dr. Thomas, for your wonderful address, the keynote address. You told us about the history of the filters then, and it is very surprising that 98.8% of in US the cigarettes are available in filtered form. So they have filters on it. And all over the world, more than 90% are filtered cigarettes. So you told us about the anatomy of the filters, then the lung and adenocarcinoma was increasing, especially in women from 1970 to 2010. And you also told about the environmental burden of the filters. So thanks a lot, sir. And so I'll now request Dr. PC Gupta for the chief guest address as a chief guest. And you may just, he's a director of HEALIS, Saxeria Institute of Public Health, Navi Mumbai. And he is a mentor to many of us in the webinar. So thanks a lot. So over to Dr. PC Gupta.
Thank you. Thank you very much, Rakesh. And congratulations on roping in my very good friend for a very long time, Professor Tom Novotny, for this very important topic on which he has done a huge amount of work. So most appropriate person to really speak on this particular topic. I think he has spoken so well and so comprehensively about every issue of cigarette butts and cigarette filters that you can only re-emphasize and restate what he has said. Very difficult to put anything new. I would just start by saying that one lesson that I have learned in sort of half century of working in tobacco control is that anything that the tobacco industry says, anything that we come across from tobacco industry, we have to be very careful because it is almost always deceptive and misrepresenting the facts. And it's absolutely started from filter cigarettes. When filter cigarettes were introduced, the terminology the industry used and it popularized everywhere in the world was that safer cigarette. Filter cigarettes are safer cigarette. And this went into really psyche of everybody that filter cigarettes are safer cigarette. Indirectly, it promoted the fact that cigarettes are safe. Not much problem with cigarettes, but filter cigarettes are safer. And it has taken a very long time for public health experts also to get out of that kind of a mindset that filter cigarettes are safer cigarettes. And of course, scientific research clearly, as Tom showed, clearly proved that filters don't really do anything to improve or reduce the health consequences of cigarettes. And, that is shown in many studies. And the main fact that industry used, and even the public health experts also agreed with that, with their own studies, that cigarettes with filters, they reduce in machine measurements, they reduce the exposures to carcinogens and toxic chemicals. And that was kind of widely reported and accepted. But you know and I just tell you a personal story. It's not a time to tell personal story, but this is quite interesting in the light of current topic. And after working for about 6 years in tobacco and oral cancer, I went to Johns Hopkins for my PhD. And in the first year, I met a doctor, I think from Cuba, uh, friendship with him, and he happened to be a cigarette smoker. Those times there was nothing great about being a cigarette smoker and studying public health. So he was a cigarette smoker, and we talked about cigarettes, of course. So he showed me his cigarette with filter, and showed how he could regulate the pressure on the butt, on the cigarette butt, on the joint of filter and tobacco, press it and reduce the air that is going through those microdots, and increase the intake of nicotine, and more satisfaction. Basically, he said more satisfaction. They said cigarette smoking becomes more satisfying if it does that. And that time, 72, of course, I also didn't fully understand, but it became very clear afterwards what was happening and what tobacco industry was doing, and how people, smokers, knowingly, unknowingly, were taking full advantage of it, but not getting any reduction in the risk. And the same terminology of safer cigarettes, safer smoking is still continuing. I mean, that's what really hurts me, that even some public health experts are also agreeing and propagating that electronic cigarettes are safer because they are reducing the exposure. But I think we need to learn from our past experiences that nothing that tobacco industry says or propagates is beneficial for health, public health. It is beneficial for company, increases the profit, but not really beneficial for the public health. And we need to be very careful about such claims that are getting propagated about filter, that got propagated about filter, and now about electronic cigarettes from the industry. Tom has already told a lot, won't repeat that, how filter do not reduce the risk and put some additional risk also. And even the company's audacity in putting asbestos filter, which is itself a class 1 carcinogen, so adding on. So I don't think we have to go believe anything that cigarette industry says or does. We got interested in, I got interested, of course, like anyone else in tobacco control, on the environmental effect. And with some friends, we were not good in filing petitions, but along with friends, we thought of filing a petition on environmental effects of tobacco. Health effects, of course, well known. Now, in India, for environmental regulation, there is a National Green Tribunal. So we looked to National Green Tribunal, and we prepared a petition. Again, we took most help from Professor Novotny's research and his papers, and about cigarette filters, and also about other environmental effects of tobacco. We prepared a long petition and submitted it to NGT. It took quite a bit of time really to get it accepted, and some hearings, and we had appointed our own lawyers also. But that document that I had shared earlier was an outcome of that particular petition and that particular fight with NGT. And since the matter was disposed after that, I don't think a great deal of progress has taken place. But as we know now even more about the environmental and toxic effect of tobacco, not only of filters, but starting from tobacco, we know from tobacco cultivation, green tobacco sickness, of course, we know, but use of pesticide and uh, getting into leaching into drinking water and use of wood for curing tobacco and for packing plastic in packing. So there are lots and lots of these environmental effects of tobacco production, tobacco consumption that are still not fully addressed. And one very important principle that I think Tom also said that is now reasonably well recognized is the principle that polluters must pay. And in case of cigarettes and tobacco products waste, the polluter is clearly the tobacco industry. So why is it that we all, those who are non-tobacco users, are really contributing and paying for the pollution that is being created by the tobacco industry? So I think we need to do much more work now uh, to get this particular principle applied to tobacco products, and to waste of tobacco products. So I don't think I'll take any more time. Thank you very much, Rakesh, and thank you, Professor, my good friend Tom, for an excellent presentation and lecture on cigarette filters. Thank you all very much.
Thank you, Dr. Gupta, for your concluding remarks on that keynote address and for your own inputs as well. So we'll be sharing the recommendations. So do you think that we should recommend for the smokeless tobacco also for the NGT and the Central Pollution Control Board?
Sure, because smokeless tobacco is a major problem. And
Correct.
even way back, I remember 30, 40 years back, uh, in Bhavnagar, we were working in Bhavnagar district, large surveys.
Mhm.
And there, the collector of Bhavnagar had banned plastic because it was completely choking their drainage system.
Yeah.
So, and we know that because of that, plastics are banned in the packaging of smokeless tobacco product. So there are definitely a lot of environmental implications for smokeless tobacco manufacturers and product and the
Yeah.
waste product of smokeless tobacco.
In the
So,
recommendation, I think we will also add those disposable vapes also, which are being used. No?
sure.
So thank you, sir. So, Dr. Paridi, you can take up the question answer session.
Sure, sir. Thank you so
There are
much.
any questions in the chat box?
Yes, I think sir has answered two of the questions. But sir, we have one more question. Kindly let us know whether there are any specific studies that cigarette filters as TPW affecting the human health through water, food items, and or air. So, sir, if you can take up this question, that'll be great. Either Dr. Thomas or Dr. Prakash.
I think that's a really important question, and I was just typing an answer to it. And it's important because, as I mentioned earlier, we've got a lot of laboratory studies based, on lots of different organisms and the effect of cigarette butt waste that it's leached out into aquatic environments, especially, but also to the land. And we can show that it affects these organisms, and we can also show that the chemicals can be found in the environment. For instance, we've done some studies in natural reserves here up and down the state of California, and we can find the chemicals in the water, in the sediment, in the surrounding soils that are based on tobacco product waste, and we know that they're there. And and again, we've seen the microplastics, probably the cellulose acetate in urban runoff. So we've got the lab, we've got the environment, We do not have that intermediate effect on human health specifically. And what I mentioned earlier is that, in terms of an environmental principle, in terms of preventing disease or preventing, human health effects, we don't have to have that evidence because, we can see the toxicity through an experimental way. And in fact, at the beginning of the tobacco scientific kind of research, it was John Banshaf, I believe, who painted tobacco tar on the backs of guinea pigs and found that it caused cancers to arise from their skin. Just that was like one of the first things. That's basically a lab experiment to show that there was carcinogens in tobacco products. So, we don't have to have that evidence. Is it affecting us now? It may be. I don't know. I mean, maybe the microplastics that are from tobacco products specifically, and think about it, 6 trillion cigarettes every year. They're out there getting into water systems. We can find them in our drinking water supplies. We can find nicotine in them, and that's more likely than anything else to come from tobacco products. Maybe that's what's causing this increase in, for instance, Alzheimer's disease, or increase in neurological disease, Parkinson's disease, or diseases that we don't really have a good sense of what the exposures are. We guess that maybe it's pesticides. Maybe, who knows? But what we do know is that these chemicals that leach out in the plastics are harmful to living creatures. They can bioaccumulate, and therefore we should be able to regulate them out of the environment if they're coming from some product that is not essential to us. And that's certainly the case with tobacco products.
Thank you, sir. We also have one more question. Do we have any study also about the smokeless tobacco pouches which litter as they all are plastic pouches? Any comments on that, sir?
Yeah, in fact, because of that, there was this case was filed, and there was directive from the court that, and still that is regulations are still in force, that plastic packaging cannot be used for smokeless tobacco products. The major issue with that is that they are generally single-use doses. So there is a lot of plastic waste that is generated. And this is known again through laboratory studies, that the plastic waste that is there, it has a lot of traces of smokeless tobacco, and that has the toxic waste kind of, it is a toxic waste, smokeless tobacco product waste. So that those things do apply, and we have a court order that plastic should not be used for the packaging of smokeless tobacco products. So manufacturers have kind of, they always do, they have circumvented and come out with material which is not 100% plastic, but they are using it for packaging smokeless tobacco product. And they require material which is sort of moisture proof, because otherwise the smokeless tobacco product under will get caked and people will not like it. So smokeless tobacco also similar problem is definitely there.
And now there's another menace of oral nicotine pouches. So environmental degradation is because of those pouches and those packs also. But they may be using tins or plastic boxes. The oral nicotine pouches. I think they are using tins, no?
Yeah, I have not seen those, but yes.
Okay.
Yeah, I've seen that. It's like there used to be this plastic tin for smokeless tobacco, chewing tobacco. It was kind of a marker. You put it in the back of your jeans, and you were a tough guy cowboy. But now the nicotine pouches. You're right. I've seen those tins as well, and that seems to be very popular among the computer bro culture in particular.
I saw a few in America a few years back. They were all using tins only.
Yeah.
Thank you, sir. So there's one more question. BD without plastic filters and their contamination to the environment. Any thoughts on that?
The BDs that are sold in India are without filters. The BDs that were sold in the USA, exported from India and sold in the USA, those BDs were with filters. But in India, I've not seen BDs with being sold without filters. Now, the last part of the BD, which is basically leaf, in which tobacco is wrapped, dry leaf of Tambourine, Diospyros melanoxylin, that is discarded everywhere. And certainly that would have some toxic elements coming out of the smoke and remaining part of tobacco. But, and a lot, because BDs are sort of 7, 8 times more common than cigarettes in India. So there will be a lot of that, but we don't have any studies on the effect of that or how much they are there in the environment, how much they are affecting the environment.
Yeah, and the biodegradable, the material is biodegradable, so it's not going to last as long as a filter, which, it's going to have those chemicals leaching out over time. And again, it has the plastic pollutant. So relatively speaking, environmentally, BDs without the filter and unfiltered cigarettes are, unlikely to be as environmentally hazardous.
Yeah.
And Dr. Gupta, aren't the leaves biodegradable? The leaves of the BD?
You are muted, sir.
So you
You're
mute.
muted.
Sorry. Yeah, those are the dried tree leaves of Tambourine. So they are biodegradable, yes.
Biodegradable, yeah.
Yeah.
But the tobacco product waste is always there because of the
Yes, absolutely.
Yeah.
Any concluding remarks by you, Dr. Rakesh Gupta? So we can see you. Very short, yeah.
I think everything has been said,
Yeah.
and my question has also been answered very satisfactorily. Nothing to add, actually. Best compliments again to Dr. Novotny for masterly oration and information we got, and Dr. Gupta sir, as always, and both you and Dr. Sonu for enlightening us. Thank you again for holding this webinar.
So we can have short 2 questions before we wind up, before we proceed for the vote of thanks. So anyone, they can unmute themselves. If we have no more questions, then yeah.
I just have one inquiry, and I don't think that anybody is ready to answer that inquiry, but let's think about it. Is there anything very, very unique that we can tell to the cigarette smokers, which will sort of make them really think about smoking the cigarettes which have got filters in it, or not smoking them at all? In other words, quitting completely. Is there anything that we can tell them to really get to their heart that, all this was just make believe, that these things are not affecting you or anything?
I think the message is that all cigarettes are harmful, filtered or not. And that when you add the filter on, you're adding also now an environmental plastic pollutant, and to say, look, think about the environment as well as your own health when you smoke filtered cigarettes.
Mm-hmm.
Yeah. So Dr. Preeti, I think we can proceed with the vote of thanks.
Sure, sir. Thank you everyone for all your questions. I would like to formally thank Dr. Thomas Novotny, Dr. Prakash Gupta, sir, for taking out time from their busy schedules and to attend this webinar. We are really grateful and thankful that you could attend this webinar. Dr. Prakash Gupta as the chief guest and Dr. Thomas as the expert in this. I would also like to take a minute to thank Dr. Sonu Goel, who also gave an address at the beginning. So thank you, sir, for giving the address and taking out the time to attend this webinar. I would like to thank all our participants who joined us today for this. Thank you very much. Last but not the least, the main person, Dr. Rakesh Gupta, who's organized this webinar. Thank you, sir, for organizing this webinar. And thank you, everyone, for joining in. We hope it was a productive session for all of you. And we hope that you take some good takeaways from this webinar. Thank you, everyone, for joining.
We'll be circulating the recording of this
Thanks.
webinar and also circulate the draft recommendations, the doable ones. Yeah. Thank you.
Wonderful.
Thank you.
Thank you. Thank you all
Thank
very
you.
much. Thank you.
Thank you.
Thank
Good
you.
day
Bye.
to all.
Thank you. Good
And
to
Thank
see you,
you.
my friends.
thank you. Bye.
Thank you.
Thank
Thank
you.
you.
Bye bye.